in late January, I had emergency hernia surgery. During my recovery, I developed pneumonia. And during the weeks that I was trying to recuperate from the pneumonia, I started coughing blood clots, went to see a specialist, and was on multiple rounds of antibiotics, steroids, and a variety of medications. Got up in the morning to make my coffee, and that's pretty much all I recall. Didn't feel myself getting dizzy before I went down, didn't feel off, didn't feel anything, and actually I don't recall at all just collapsing onto the floor. I was able to eventually, after gaining some composure, crawl over to my phone and called my boyfriend to please call an ambulance for me, because I was really challenging my cognition at that point and knew I was afraid that I would not be able to give them the details of all the questions that they would pose towards me, and I just needed to let go of things and let somebody else take care of it for me. They took me directly from the emergency room to a CAT scan, back to the ER, and immediately up to the cath lab. It didn't take them much time to determine through diagnostics that it was pulmonary emboli in my lungs.
Sandy presented to Bethesda Hospital one morning after having a syncopal episode where she passed out abruptly in her house, injuring herself and obviously creating a sense of panic. She was able to fortunately call for help for herself and was able to get to the emergency room, where their prompt workup led to discovery that she was having a submassive, if not massive, pulmonary embolism, which is a large blood clot in her lungs that was causing significant strain on both her pulmonary and cardiovascular system. Upon getting called, I was able to organize prompt measures, including getting an ultrasound done at the bedside of her heart in the emergency room, and I was able to visually directly see that the right ventricle of her heart was severely compromised by the process, and visually confirming the very tenuous nature of her diagnosis. So pulmonary embolism is when a blood clot, which presumably forms in the legs, in the veins of the leg, somehow dislodges, travels up the venous return system through the inferior vena cava, through the right-sided chambers of the heart, the right atrium and the right ventricle, and then travels to the pulmonary arteries, which essentially are end paths. So the arteries get smaller and smaller, and ultimately the clot travels and gets wedged into occlusive positions in the pulmonary arteries.
From what I've been told, they took out a few dozen clots from my lungs. So keeping things in perspective, traditional therapies would not have worked on me.
The Inari FlowTriever device just came to market within the short time before we met Sandy, and our hospital was one of the first centers in the region to get our hands on it, to start to use it, and the results have been fantastic. So it's always on the forefront of my mind when I'm being called with pulmonary embolus patients, is this someone that we can treat with a thrombectomy, and again, balancing out all of these features of rapid treatment, rapid improvement of cardiac status, rapid improvement of respiratory status, avoiding the need for TPA and blood thinner risk. To me, it was a very straightforward decision that this would be the best treatment for her.
You know, God works in mysterious ways, and I was expecting my first grandchild in a few weeks. And when this happened to me, I realized immediately that truly any change of any sort, whether it was a different hospital, a different doctor, a different prognosis and treatment or therapy, would have impacted me significantly. The likelihood of surviving this, you'd have to ask the doctors, but from what I can gather, would not have been in my favor had it not been for the Inari devices. For me, this was really something that I wanted to make sure that I would get through this, that I would get to hold my granddaughter, who I recently just did, and she is a joy. She is just adorable. Most importantly, I feel great. I feel 100% today.